Parasternal at 20. Parasternal at the level of the descending aorta. So we want the parasternal to be on axis, horizontal, going across the screen, right? We want to be able to see our mitral valve and aortic valve open and close, as well as see the entirety of the ventricle that we visualize here, as well as the immediate ascending and root of the aorta as well. And we're going to zoom our two valves here. Making sure that they're opening and closing properly, and that we don't visualize any sort of vegetations or anything like that. So then we're going to swing to apex. Now to swing to apex, I have to slide down, and I have to go past the next rib and angle up towards the heart. So here I can visualize the apex of the left ventricle. Then I'm going to pass that rib back up, continue to slide up, and I'm going to go to my base. So for base, we're wanting to visualize as much as that ascending aorta as we can. Then we're going to zoom our aortic valve. Once we get a few beats, I'm going to freeze it, and I'm going to scroll to where on the cycle? Around the end of the T wave, when the valve is mid to end, when it's wide open, right? LVOT, back it up here. And then my annulus. Capture that picture. Then I'm going to scroll to my QRS. Let's see if I like it. That's good. And I'm going to do my sinus. My junction. And my ascending. Notice that I went up as high as I can for the ascending. Now, if you don't get a picture like that, you can do them in separate images. It's okay. But if I slide up even further, I can technically get even more of her ascending. So when I'm scanning in the real world, I'll slide up even further and just do the ascending by itself at the level or above the right pulmonary artery, which is right here. Okay, so then we go back to our parasternal. We grab our cursor, and we're going to do M mode through our aortic valve first. And we're going to measure our aorta, left atrium, and cusp separation. So when I can visualize her cusp this clearly, I'm going to go right at the cusp and go down to where I visualize the next cusp. Then, if you've held your image, you can unfreeze this and press the update button on some of the machines and swing it out to the mitral valve. measure our D to E, E to F, and our EPSS. And then we're going to come out and do our right and left ventricle and mode. Now for this one, we're not going to measure on it, but we want it as clear as possible in case we did want to measure on it. So we're going to take that image. So now I'm going to get my parasternal nice and opened. I'm going to freeze it. We're going to scroll to diastole when both valves are closed, and we're going to do our two-dimensional measurements. So I have my right ventricular free wall. Our right ventricle, our intraventricular septum, and our LVPW. Scroll to end systole, but you still want the valves closed. No more blood going in, no more blood going out. Notice where I'm starting this measurement. I'm not including that right ventricular, that little piece of right ventricular tissue. Notice how I'm passing up the chordae. And then I'm also going to do my LA diameter because the atria are their largest at this time as well. And we're going to investigate our valves a little further. Color my mitral valve first. See a very trivial amount of mitral regurg. And I'm going to bring the box up, widen it just a little bit to look for aortic regurg or potentially stenosis turbulence. And we're going to go to our intraventricular septum. I wanted the entire length of the septum. And then I'm going to hit color compare. What are we looking for here? VSDs, right? Which is considered a shunt, but yes. So then from here, I'm going to swing to my right ventricular inflow track, decrease my depth and my sector for my area of interest, color, and I'm going to leave my simultaneous on. The biggest thing about this color is I'm coloring the entire valve, most of the atria, and a little bit of the distal portion into the ventricle. And what am I looking for here? TR, correct. So then my cursor is going to go directly through the little amount of TR that I see in a continuous wave. Adjust my Doppler accordingly. And if you see a little bit of regurg and you want to try to get it better, just hit update and continue to try to get it better. But don't spend too much time on trying to get a very trivial amount from your classmates. If we see enough regurg that we feel comfortable peaking, tricuspid valve, TRV max, and we would peek it. What's that TR going to be used for later? The RV-SP, correct. So then same thing for our outflow. We're going to decrease our sector width a little bit, put our color over the valve and the main pulmonary artery, as well as a little bit of that right ventricular outflow track. I'm going to take that. I'm going to put my cursor in the RVOT right outside of the valve and hit pulse wave. And then for this one, we are going to go ahead and get our Vmax. Do this one. And if you hold your view, you can continuous wave, or you can update and make sure you're right in the center of that valve. First, we're going to do our continuous wave for the velocity. Turn my gain down a little bit. Trace our pulmonic valve VTI, and we can also go ahead and peek it here. Now mind you, when you do trace, we get that the 5 pieces of information. Vmax is a part of the information that we get, or peak velocity. Now I'm going to look for regurgitation. This is about all we're going to get from her. I'm going to do my pren just to show you guys if I were going to practice that. I like this one over here. And pren is that end diastolic peak that we're going to do. So now I'm done in my long axis, so I can go ahead and rotate into my short, and we're going to start down at the apex level. So I'm going to look for my prettiest apex that I can find.
Oh, sorry.
You good?
I try to. Okay.
So this is our apex. This is our papillary level. And then we have our mitral valve. Make sure you see that anterior and posterior leaflet. And then we're going to go up to our aortic valve level. Sometimes you have to slide up or down the rib space between some of these to get the best image that you can. We know that we're at our aortic valve level when we see those 3 cusps and we don't see the bouncing of that bottom portion of the annulus. And we're going to color our pulmonic valve. Take off my color compare. So a habit that a lot of you have is wanting to put this all the way to the right of the screen, and that's not always the case. I can put this all the way to the left of my screen if I wanted to. Do you guys see that? It's all about how you're heel toeing or angling. So I can put it all the way over here if I wanted. So you can't assume that the pulmonary artery is all the way to the right unless your image happens to have it all the way to It's all about how you're angling and your positioning for optimizing your image. So I'm gonna go ahead and acquire that. We're gonna do our Doppler the same way we did before. So we're going to pulse wave. We're gonna peak. And we're going to continuous wave. I try to adjust my scale, my baseline, my speed, as much as I need to get a really good image. How much of a portion of the screen should be covered in Doppler? 2/3 of the screen. I'm always hugging the chin, not the beard, when it comes to measurements, to make sure that I'm not overdoing it. I'm not sure if I can get her PR here. I don't really see it, but if we did, we would obtain the print again. And then now I'm going to color my aortic valve. I want the box just large enough to cover the valve and a little bit of the surrounding structures. And then we're gonna swing it over and do our tricuspid valve. Now sometimes to get TR to come in nicely, do you see how my image kind of goes in between mitral and aortic? Sometimes that is appropriate. That's a little bit more of an unconventional window so that you can optimize TR. And then we're going to continuous wave through that tricuspid regurg. Does everyone see the little bit of TR? Optimize our image here. And then we're going to get our nice apical forward image. Then we're going to optimize our left ventricle, which you can either decrease your depth, practice moving your focus as well to help, and then decrease your sector as well. Then we're going to move over to our right side. So you can use the tilt feature as well as sort of narrow your sector and kind of swing that right heart into focus. You may be able to decrease your depth just one or so. And we're going to take a picture of our right heart. I'm going to freeze this and measure my right atrium. Do our major and minor, or length and width, depending on which machine you're on. And your end systolic area. We always start and finish tracing at the valve annulus for any of the chambers. Alright, so then we're going to push you back. Push you back. So let me optimize my right side again. Alright, so we're going to color our tricuspid valve. I want the entire entire atria covered and the entire valve, a little bit of the distal portion into the ventricle. And then we will take an image of that. Put our cursor directly through our TR jet as parallel as possible to flow and continuously. I did not mean to do that. There we go. So try not to peak again. Pretty consistent with the previous velocities. I'm gonna go back to our left side, optimize our left atrium so that we can get a volume. When getting this left atrial volume, you want to ensure that the atria is as wide as it's going to be, that no more blood is going in or coming out. Make sure we don't dip into the pulmonary veins, and always start and end at the ends. I'm going to color over our mitral valve. Take an image of that. Pulse wave for diastology. We're going to do pulse wave at the tips of the leaflets when it's open. We're going to do our E, D cell time, A, as well as our A wave duration. Decrease my sweep speed to 25. Go ahead and Valsalva. Breathe. Make sure I label this. Come back out, and we're going to continuously through that mitral valve. This is where I want you to decrease your scale so that you can make the waveform nice and large, so that it's easier for you to trace. But we always want how many on the screen? 3. At least 3, so 3 to 4. I'm gonna do this guy here, hugging that waveform. And I'm also gonna do my pressure halftime. Then we're gonna do our party pulse. So we're gonna do our tissue Doppler of the lateral annulus. Make sure you do your E and not your A. which might I mention looks pretty clear.
I don't think it hurt you. It's beautiful.
So I'm gonna go ahead and put our, let's do our color between the aortic and the mitral. I'm gonna put our cursor right between there. So that we can get our IVRT, which is a mitral valve measurement at the end of the T-wave. Then we're going to take our nice apical 5 image. We're going to color our septum. I'm going to bring this box down to the aortic valve, maybe make it a little bit smaller. I'm going to continue this wave through that valve. What are we looking for first? Regurg. So I'm going to do what to my scale? Increase the size of the scale so that it decreases the size of my waveforms, because AR would be very high velocity if it were present. And I would bring my baseline down to the bottom. Then we're going to come out and we're going to do our pulse wave right before the valve, but not too close, in our left ventricular outflow tract. We're going to do our peak and trace. And then if we hold our image, we can move our cursor just a little bit down directly into the valve as parallel to flow as possible and switch to our continuous wave. And we're going to do our aortic valve trace. And we're going to get our 4-chamber back. Make it really pretty. I'm going to pick a chroma map. Let's do. I'm first going to take the image. And I'm going to freeze. And in the same heartbeat, I'm going to do my diastolic and systolic measurements. trace on the left ventricle and colorize again. Get our volume of our left atrium into. Color. Three chamber. I'm going to take a pretty three chamber. Color our aortic valve first. Trace. Peek and trace. Then we're going to color our mitral valve. And now we're off to subcostal. So we're going to do subcostal 4. Go ahead and take a big breath in for me. Hold it. Breathe. Big breath in, hold it. Interatrial septum, breathe. Intraventricular septum. And we're going to go to our IVC. Color compare. And then sniff. And measure our IVC. wave, the hepatic. You can see we get our RVSP. Then we're going to get our descending aorta. For our aortic arch. Pulse wave. And that is all.